Good afternoon, everybody. Can you hear me? This is what I think is called a 30-second warning that we're about to start live streaming. So we've now started. Good afternoon. My name's Jill Alexander. I'm the Chief Executive at Hartlepool Borough Council, and I'm delighted to welcome you all to this Health and Wellbeing Outbreak Control Engagement Working Group. We might need to come up with a snappier title. Unfortunately, Councillor Shane Moore, who chairs this, is pretty ill at the moment and has therefore not been able to chair the meeting. And he's asked me if I could chair it, since we don't at this stage have a vice chair nominated or elected, which is something we'll come to under the terms of reference, which is part of this agenda. As everyone is aware, this is a remote meeting and it's being live streamed on the website and recorded. And I'm going to hand over now to Amanda Whitaker from our Democratic Services team, who will take you through a roll call and also just give a little bit of advice as to how to handle the meeting as we go forward. Thank you, Amanda.
Thanks, Jill. As Jill's indicated, I'll begin the meeting by way of a roll call of all of those in attendance remotely. May I request members to confirm they have a paper copy of the agenda and can both hear and see in the meeting. I'll begin the roll call. Normally I'd be asking for Councillor Mower, but as Jill's already indicated, Councillor Mower has submitted apologies. Moving on to Councillor Thomas. I'm not sure if Councillor Thomas has joined us as yet. I'll move on to Councillor Harrison.
Hello, yes, I'm here.
Thank you, Councillor Harrison. And then Denise Begucken.
I'm here and I've got the papers. Thank you.
Thank you. Dr. Tim Butler.
Yes, I'm here. Thank you.
Thank you.
Yeah.
Yeah. And I've got Graham Niven from the Clinical Commissioning Group. No. Leslie Wharton from North Tees and Hartlepool NHS Trust.
Yes, I'm here. Thank you.
Thank you. And Craig Blundred.
Yes, I'm here and I've got the papers.
Thank you. I've got apologies from Sally Robinson. I've also got an indication that Peter Graham is here substituting for Superintendent Sharon Cooney. Is that correct?
Yes, I'm here. Thank you.
Thank you. Jill Harrison, I think, has got apologies. Tony Hanson.
No, I'm here. Thanks.
Jill here. Oh, sorry, Jill. Thank you. Tony Hanson has apologies. Ed Turner.
Thanks, Amanda. I'm here and I've got the papers.
Thank you. Christopher Akers-Belcher from Health Watch.
Yes, Amanda, present, and I have the papers too.
Thank you. Julian Penton. We've got Julian with us.
Yes, Julian Penton here and access to the papers.
Fantastic, thank you. And then finally, Jacqueline McKenzie from Primary Care Network.
Yes, I'm here and I've got all the papers. Thank you.
Thank you. That concludes the roll call. Is anybody else in the meeting that I've not called? No? I think the final thing I would say then is just a reminder that this is a Teams meeting. If everybody could keep the microphones on mute when they're not participating in the meeting, and if anybody's wanting to speak, if they could just use the raise hand facility, and then the chair will be aware that you want to speak. Okay, thank you. I'll hand back over to Jill.
Thank you, Amanda. So moving to item 2, unless there are any other apologies anyone is aware of that hasn't yet been notified by Amanda. No. So if we could move to item 2, which is the terms of reference, which I think have been attached. And Craig Blundred, our Acting Director of Public Health, will explain the status of the paper before you. Thank you, Craig.
Thanks, Jill. Yes, the terms of reference, we've obviously circulated them prior to the meeting, so I hope everybody's had an opportunity to have a look at them. Obviously, they outline the purpose and functions of the subgroup of the Health and Wellbeing Board, which is to provide partnership oversight of the activities that we carry out in terms of our outbreak control work, and that's linked to the outbreak control plan. And also highlight that a key element of this is to also support the communication and community engagement work and have oversight of that as well. And that's on a dual basis, I think, at the moment, and that covers certainly comms and engagement in terms of the prevention work that we're required to do as part of the outbreak control plan, but also how we deal with community engagement and communications when we do have an outbreak situation and work through that. As you'll see, it's quite a broad membership that we have within the group, and this is very similar to other areas, and it just reflects the importance of the multi-agency approach to outbreak control and prevention. I think listed there, we have, I think, representatives from most of the groups that we've listed, and I think really we've only finally got to get one representative, I think, from the faith community to make that a complete set. As you'll see, this is a core group, and we will bring in additional participants with specialist knowledge and skills as and when we have an outbreak situation, and that will depend on that situation. We have listed there as well potential other partners who we can bring in as and when. And working through that, the frequency and status of meetings, I think we've initially got on a monthly basis, but again, I think the requirement would be, should a situation develop or occur, we would need to stand up the group as and when that happens. So I think it's worth bearing that in mind, that we may be calling on you at reasonably short notice if we do find ourselves in that sort of situation. Hopefully we won't, but we need to really be aware of that. And I think just again, as we work through that, we have attendance at meetings and appointment of substitutes, which is standard items, and quorum for the working group, which we've put at 5 members. So I think that comprehensively lists and outlines exactly what we're trying to achieve with the outbreak engagement working group. I think one of the things we just need to qualify, as we mentioned earlier, is that we need to elect a vice chair, because we haven't actually done that yet. But also in terms of reference, there has been a slight error within that, and we have missed off the chief executive from the attendance lists, which was completely unintentional. And obviously that's Jill at the moment will change to the managing director from September. So we need to add that in as well. I hope you've all had a chance to have a look at that. So if there's any questions or queries you want to raise regarding that, now's the opportunity.
Are there any questions about the terms of reference? Or if not, are people happy to agree them as the terms of reference for this working group? Excellent, thank you. There is the issue of a vice chair. Obviously, we're in this situation today with Shane being unwell, and it would be helpful to take views about the notion of having a vice chair for this working group. Are there any views on that at the moment? Or should we come back with some suggestions? Well, following that, Denise, thank you.
Thank you, Chair. I was just wondering if we could ask for nominations to be submitted within the next week, which might be helpful. It's always good to have a willing volunteer rather than a press gang chair, isn't it?
Yes, thank you, Denise. Clearly, the fact that you're about to replace me as the managing director shows that our brains are now in sync, because I was just about to suggest that. So if people have got any nominations, if they could let us have that, that would be very helpful by the end of this week, potentially, if that's possible, whilst it's still fresh in your head. Obviously, we have a model for the board overall where the council chairs it, but the vice chair is taken on by a health partner. That may be something that people want to consider and get back to us by the end of the week, and then we can perhaps get that just sorted out for the next meeting. Denise, is your hand still up for a reason, or are you just not? Am I supposed to lower it or something? Yes. Okay, thank you. So can we move to item 3 of the agenda, which is the current outbreak control situation? And again, Craig, as an opportunity for you to brief members as to what the data are telling us at the moment around the current position in the town. Thank you.
Yep, thanks, Jill. Again, the current position in the town is quite, well, I hesitate to say this, reasonably quiet in terms of outbreak work, touch wood. We are currently, I think, have one care home which has had 2 cases, which is the initial definition of an outbreak, 2 cases linked by other factors. So we are, and that's being managed in the way we will generally tend to manage our care home outbreaks. We have a very efficient system set up to do that. And within that case, that would probably come to the Outbreak Control Board if there were any concerns or we had to escalate it further beyond the positions we're currently in. So we have generally had quite good experience of managing care home outbreaks and have an effective wraparound process for that. So there are, at this present time, there are no concerns about that particular outbreak. In terms of the other areas, in terms of schools, workplaces and communities, we don't have any ongoing outbreaks at the moment, and indeed have only had one in the past that was escalated to an outbreak control team by Public Health England, which was a factory related outbreak and which was managed quite easily and quickly. So at this point in time, it's relatively quiet. We do have sort of increasing rates at the moment of positive tests within the community, which we're keeping an eye on. But none of those are reflected as an outbreak situation at this current time.
Craig, I think members of the working group may be aware that we had some coverage in the Hartlepool Mail this weekend about a slight concern around rising numbers, and I think it might be helpful for the members of the board just to clarify the situation and what's happening in terms of the messaging that we're doing across the town in terms of the key messages we want to get across. Thank you.
Yeah. Yes, the rising numbers, they've been flagged up to us. We have started, it might be useful to explain about the data we're actually getting, because I think there has been a lot of concern around the sort of public health communities around the type of data and the timeliness of data that we are actually receiving. Certainly in the last week, we have started to receive more data through Public Health England's testing and tracking and tracing process. And we're actually building quite a comprehensive set of data returns that we are having access to at the moment. What that does is gives us an indication of the numbers of positive tests we're receiving, and also Public Health England produce documents that show us in comparison to past numbers. And I think it's showing that we are actually seeing a bit of an increase in the numbers of people coming through who have tested positive. We're obviously keeping an eye on that because it is a concern that we need to be aware of, and we're using the data we're actually getting now to develop reports to see whether we've actually got any particular hotspots or any key areas to look at. What we're doing now is providing information. We're developing a newsletter to go out in conjunction with our comms team to reinforce the messages really around the usual social distancing, good hand hygiene, and obviously now to back up the government guidance on face masks that came into play over the weekend. So we are actually enhancing now the messaging that's going out to the public, and we're also going to start doing some more in-depth prevention work as part of the outbreak control plan, because I think it's useful to reinforce, but also I'll be coming back to this sort of later on when we talk about communications, that we actually, and the communications plan, that we actually need to include prevention as a key part of the overall outbreak control work. We're not just waiting for outbreaks and responding. Prevention is a key part of this. So we're looking at developing that work over the next few weeks. But certainly we are increasing the messaging that's going out to households. And one of the things I'll be doing in the next few days is having more of an in-depth look at the data that we're getting from Public Health England to see if we can find any patterns within that to really help us target that information as well.
Tim, you have your hand raised.
Yes, thank you, Craig. Just a few questions, Craig, just to put it into context. You say, just to get a feel, you say numbers are rising. You've partly answered my second question, but the first one is, could you give us an idea of what those numbers are like? How many? Number one, because I see the hospital data, the people admitted to hospital testing positive, but I don't see the community data. And the second point on that is you said regarding patterns. You partially answered it saying you're going to look for patterns. Is there any indication at all at the moment? Are these community acquired? Are these hospital acquired? Are these in healthcare workers? Are these in frontline staff? Just any sort of indication about the cases that we are seeing and how many? Thanks, Craig.
Yeah, I think the numbers we have at the moment are relatively small numbers, but I think it's in relation to the absolute numbers. It's in relation to the actual rate, which is flagging it up as slightly more for concern. So I'm thinking, if I remember correctly, because I haven't got the data in front of me, I think we were seeing somewhere in the region of around 13 cases over the last 14 days. Which have tested positive. And again, I need to have a look at that to see whether that's in relation to increased testing or whether it's in relation to anything more of concern. And that's what we're able to do now with this additional data that we've actually had. Obviously, we had a care home outbreak, which had an increase in numbers there as well. And I think what we have to look at is take those out as well, because there's a lot of care home testing as well that's actually going on. So yeah, at the moment, the data, I think some of the data we are able to identify where people work and whether it's actually in the community. But the data, certainly we get from the test and trace and some of the other PHE data isn't as nuanced as that. So we need to look at things like postcode and look at mapping for that as well. We're getting much more data, but it's not as complete as we would like it to be at the moment, I think it's fair to say.
Okay, thank you. Difficult question to answer.
Yeah, and I think it also comes into something I was going to raise as well, is around what sort of information we can bring to this meeting as well, because I think that's also important. One of the things I'm aiming to do now we have this data is to have a daily sit rep that we set up in order for us, certainly within the council and our health partners, to be able to monitor the situation as we go along. And clearly, while sort of looking at developing a particular report that we can share, certainly with partners as well, to inform these meetings prior to coming. Unfortunately, as I say, we only got access to this data in a significant amount towards the tail end of last week. So I'm still in the process of looking at what we can use it for and what we can get out of it. It's a much better situation than we have been in, I think it's fair to say, in terms of the data, but I think some of it can be improved. But it's also, I think, one of the conversations we probably need to have today is what sort of information I think would be helpful for this group, bearing in mind it's an engagement and a coordination group, and also bearing in mind that some of the data we obviously have restrictions on how we can share it because of the level of the information it's at.
Yeah, thank you.
Yeah, so just to summarise, we've only just been given access to data which we think can help drive an intelligence, of and an understanding of what is actually happening in the town. Certainly the first cut of data, as people will be aware, there were issues around data quality and duplication, etc. And our team are currently are working on different ways of presenting that data, which would be useful to members of the board. If there's anything that you would be particularly interested in seeing presented, we obviously have to manipulate that data in a way which protects, and operates within data protection, et cetera, et cetera. So we're looking at ways in which we can provide analysis to the board. But if there's anything that you'd be particularly interested in, it would be helpful, I think, for Craig and Dean, who I think is also present, who's working on the data analysis, to hear those views just now, and then obviously be in a position to look at how we can circulate information to the board on an ongoing basis. Are there any views at this stage? No. Tim? Yeah.
Thanks. It was really the motivation behind my question, because if there are messages for our primary care community, if there are messages for our hospital community, are these nosocomial infections, or the healthcare staff, which I know Public Health England issued a bulletin to healthcare staff where we did have the virus circulating. And it wasn't patient to staff. It was staff to staff in the coffee rooms in the hospitals, because they weren't socially distancing, because they were the only ones at work at the time, or they were the only ones who weren't social distancing. Everybody else was staying at home during the peak. So really it's to see if there are messages for any sectors that we do have some influence over, such as the healthcare community or local authorities, that we can actually say. And that's where I will be seeing really important, are there groups of occupations that we can actually identify and put out, are they taxi drivers? Can we say to our taxi drivers? That type where we could actually highlight and drill down on some. So I think occupation is very key as well.
Craig, any comment on that? Are we able to get down to that level of detail? Yeah.
I don't think we are actually. I think we've got some occupational data that comes in with some of the data from PHE, but I think having a quick look, and I think Dean might be able to back me up on this or contradict me, whichever. I think that the data fields weren't often filled in, and I think it's the quality of the data that we've got to look at. I agree, actually, that is a key area we do need to focus on, and particularly because we have our community stroke workplace sort of work stream within the outbreak control plan. And I know that we are going to be looking at, certainly for businesses, trying to bring together messages that are appropriate for them. But you're right, again, in terms of the healthcare side as well. And certainly I think that potentially at the moment may be a gap we have. And I think we need to look at how we sort of bridge that gap and look at the data. But I don't know if Dean actually has any other comments on that.
Yeah, the occupation field is very inconsistently filled in. So we have a few of the occupations, but we don't have enough to use it in any meaningful way, unfortunately. Hopefully it's one that they're going to start insisting is filled in better. But until that point, there's not a great deal that you can do with that field.
I think nationally, certainly DSPH have been pushing for not just occupation, but actually workplace to be included as well. And I think some of that can be sort of found in an outbreak situation through the test and trace process, if they're able to get that. But again, it doesn't come to us as a standard at the moment. So workplace, I think, would also be a much better field to look at as well. But there are representations, as I say, currently being made to try and get access to that data. As I said, we've come a long way, I think, in terms of the data, but it's still not everything we actually need.
Yeah. No, this has been helpful debate, and we'll make sure we continue to press through Public Health England and the Local Government Association and the NHS routes to try and get greater diligence around getting those fields completed. Michael Horton, I think, is indicating. Yep.
Yeah, thank you. I just wondered if a start for 10 might be to start to share some of the data and some of the trends around schools, care homes, and healthcare settings, just as a starter, accepting that there are some issues getting data for workplaces and other areas, but that might help to just get the kind of report or charts sort of started off with what we've kind of got already, and then build it from there. That might help move it on a bit. Yeah,
that's helpful. Yeah. So we've obviously got trying to push on the occupational groups, and if we could start providing some analyses as to what the trends have been in relation to some of the key high-risk settings as well, I think that would be helpful in the way that we're presenting information to the board. Brenda Harrison, Councillor Harrison.
Thanks, Chair. One of the things that I think is probably more difficult to get data on is just the general community. So you might be able to get data from various works and institutions, but just generally from the public, it's very difficult, and we probably don't have that kind of information in order to help situations. What I'm more concerned, well, not more concerned, but one of the concerns is that a lot of people are feeling very vulnerable and very worried about going out. I think the fact that we are wearing masks in shops now has actually helped that. certainly from a personal point of view, it's made me feel more confident about going into shops. However, there are, I think, still a lot of people who need that kind of reassurance that we can give, hopefully. But obviously, we need to be reassuring them, having the kind of information that we should have in order to reassure them. So I think that's probably one of the more difficult areas, just the general public.
Craig, Dean, anything to comment on what level of geographical information, I suppose, may be available in terms of and how that might be presented in a way which, I mean, obviously small numbers are difficult to make connections around, but small numbers can become large numbers very quickly with a super spreading virus like this. So what kind of information might be available on that?
I think that is the challenge, you're right, with small numbers. And I think that also brings us challenges around data protection and that sort of thing as to what we can actually share. I think obviously we do get regularly updated data for Hartlepool as a whole, which shows us what the level of positive test stroke cases actually is. And I think we can use that and use that in our communications. I think Dean might be able to add to this, but I think certainly using some of the data we get with small numbers at the moment, whilst it might seem like a rate is quite useful with the small numbers, it can change and fluctuate quite quickly as well. So that provides us with additional challenges around, getting it down to specific neighbourhoods, but and that side of things. So I think we can use that, we can build it into the communications, and I think we have done, but I think we also need to be careful about how we do that and how it actually reflects what the true position is and what that means in a way that is meaningful for people as well. And I think possibly that's also one of the things we can think about when we talk about the communications plan, is what it is we actually want to communicate. And again, we'll come on to that in the relevant agenda item, and that's really helpful for feeding into that. And I think it would be quite useful to have a discussion as to certainly what we can do to make people in the community feel either more confident about going out if they need to, but also about having a truly reflective awareness of what the current situation actually is as well, because we obviously don't want to lull people into a false sense of security and have people not socially distancing or thinking they don't need to wear masks or anything like that as well, which again is an important part of the prevention. So I think we need to think very carefully about how we present that data and what it actually looks like for people in a meaningful way.
Can we take away a kind of question around, is there a way in which we can, in a sense, help ourselves understand where we might be facing a particular hotspot communities and how we manage that situation and present it? I mean, I think the main thing, it's a difficult messaging world that we're in at the moment, because on the one hand, we're wanting to help build confidence, and on the other hand, we are in a very uncertain situation. And we know how very quickly with this virus, a relatively small level of concern can escalate very quickly into a spike. And what we also know is that social distancing and good hygiene works. So we need to really be getting the message out somehow that the confidence building is linked to good social distancing and good hygiene. And that's, how we need to start thinking about how we nuance and press home some really important messages around we're not out of the woods yet. And we need to continue to protect ourselves and each other. But perhaps that will take us into understanding how we might move forward together under the outbreak control plan and then the communications plan going forward. But I think that's been a really helpful debate in relation to how we might be able to start presenting data in a way which helps us understand how well we're doing in the fight against this virus as a community, and whether we need to start being concerned or escalating concern in relation to either occupational groups, some key settings, or some key communities. So I think that's been helpful debate, and Craig and Dean, who's our technical analyst behind all of this data, can take some of that away and come back with some options, I think, in terms of how to help us understand what the prevalence of this virus currently is in the town and where we're at in terms of trying to keep on top of it. Can we move then to item 4, which is the update on the outbreak control plan? And again, I think one of the big developments in relation to the plan, which means it will need to be revised again since the last time it was considered by the board, has been the statutory instrument that's going through Parliament at the moment in relation to local lockdowns and powers, and again linked to the last debate, what the escalations would be around that. But again, I'll hand you over to Dean to take us through that.
Or rather to me, I think.
Sorry to Craig. So.
Yeah, sort of alarmed Dean there a bit. Yes, there's also, as Jill has said, that there's those elements that we need to consider around the local lockdowns and the powers that we've been given. And also we have, in the last week, had 2 exercises to exercise elements of the plan, which have been very helpful in terms of understanding how the plan is going to work and how the plan has gaps and what we need to change. I think, as we've always been very clear with everyone about the outbreak control plan, when we published it at the end of June, it was very much a working document and one that we will revise as and when we use it and as and when we develop it. And the exercise we had last week was a desktop exercise which ran through a scenario of a community workplace where there was an outbreak, and listing all of the potential partners who we would engage and how we would actually run the outbreak control plan. It was very heartening actually to note that actually quite a lot of it went very well, went very smoothly, and we were really pleased to see that. But obviously there's some elements that have been thrown up that we need to look at and redevelop, and those are around things like escalation criteria for if it becomes a larger incident, looking at who declares the outbreak and how that actually operates, what's the role of local knowledge, particularly some of the communication elements, and as we get further into the outbreak, and I think this is particularly relevant for this board, this working group, is how we communicate with communities, how we engage with the communities who are involved, and also who does that and who are the most appropriate people to do that. How do we engage with local members, and what's the role of health and other care organisations? So these were gaps that we hadn't actually got in the plan, but were flagged up and were very helpful in terms of guiding our thinking. So obviously we're going to start having that conversation today with the communications plan and what communications we need to think about, and what local issues there are we may need to consider. But we're also going to be revising things like the escalation criteria, and the other exercise we had on Friday was with the LRF and how we work closely with them, and also looking at cross-border issues with our partners, particularly Stockton and Middlesbrough. But obviously the criteria will be very similar if we had a cross-border issue with Durham or as well. So we were looking at some of those issues, and again, most of the things we identified were reasonable to include in the plan, and we're going to go away and consider those, particularly do a bit more scenario planning with our partners in Stockton and Middlesbrough to develop that and see where the communication flows are, what the escalation criteria are, and revise the plan and bring it back to the outbreak control board and so probably this board as well. So it's a very useful exercise indeed. We also have to, as Jill mentioned, the local lockdown powers. We're considering those currently at the moment as to what our role will be with that. It is an interesting situation, and looking at what the actual processes are. And again, we need to consider certainly what the powers are and how we implement them. And again, consider when we will use them and how we will get out of those powers as well, because I think that's a key element we need to think about. So at the moment, all those are a priority for us in terms of developing the plan. It is an ongoing process, but actually I think we're in a much stronger position to strengthen the plan. So happy to take any questions about that.
there any questions about the outbreak control plan? I mean, I think essentially we've, in a nutshell, we've done these exercises in around 2 areas, and obviously we've got the local lockdown powers to now revise and incorporate and then circulate for consideration. I've got Nick Timlin, who's indicating he wants to ask a question or make a comment. Nick, Tim, sorry, Nick, sorry.
Just Craig, have you sort of had any advice from Leicester, where they've, about communication and stuff like that? Anything from them?
I have looked at some of the work that's come out of Leicester and also Blackburn with Darwin as well, who are in a similar position. And I think it's interesting that one of the key areas that they flagged up was that communication, and it has to be got right early on. And I think they have done a lot of learning from that. So it has been used. I mean, it probably would be slightly different circumstances, but I think there are quite a lot of issues that were raised about identifying relevant people within the community to target communications at, and I think specifically working quite closely with members of the community as well, because I think that's key to any situation where you're facing a lockdown or anything like that. And again, I think it goes back to some of the key principles we have, certainly with our engagement group, about transparency and openness, but also working with the right people at the right time. I think that's something we need to, again, consider within our own communications plans, is how we actually work into those community groups. And I think that's a role for everyone on the call actually today, which I think we need to look at, which I'll come on to later within the comms plan. But again, yeah, those are some interesting learnings coming from those areas.
I did see somewhere a bit of a presentation from Leicester somewhere, Craig, on their early lessons learned. It might well be worth digging that out and circulating it to members of the board.
Yeah, I'll have a look for that. Yeah,
thanks. Yeah, that's a really good point. Thanks, Nick. Any further questions or comments on that? That's okay. Should we move then to the communications plan, which I think is pretty critical now for us in terms of, how we begin to understand what the kind of issues and risks are we need to try and manage through a good communications plan, and also what we think some of the options might be for moving forward. So, Craig, I think you had some points to raise on this. Yeah,
I have, yes, and I think Ed as well, if Ed wants to chip in at any point as well. I think one of the things to say is actually within the outbreak control plan itself, we have Ed's developed a communications plan for that, for the actual outbreak control plan. But I think what we also need to consider is within this group is how we actually engage in the 2 ways I've flagged up, which are the prevention message, which I think is vital to keep going and continue with, but also then how will we mobilize communications in the event of an outbreak, depending on where or when that is. I think one of the key points is to look at what actually our roles are within each of our individual organizations. One of the things I'd like us to do and like us to consider today is certainly some form of a mapping exercise to identify what roles we feel that each of our organisations will play within this. I've got a registrar starting with me in a couple of weeks' time, and I'm going to task her with pulling information together to support this. But I think it would be really helpful if we could each individually as an organisation or as members as well within that to look at what it is exactly we can contribute to that communication, because I think we need to be clear about which elements of the community we can work with and how we do that. I think that's fundamental to underpinning the actual communications plan, because we are all within different sectors as well. I think it would be quite useful. One of the things we also could work through is the role of members as well, of council members, and how they will be significant community leaders who will help us to take these messages out there and how we operate within that as well. So I think fundamentally it would be really useful to come out with a mapping of where we feel those key points are, and then we can link that back into the broader outbreak control plan, but also look at the pathways into different communities and different areas, because I think, you know, as I say, going back to some of the learning from some of these previous outbreaks, that's going to be crucial in understanding how we deliver messages and support people during these processes. So I don't know if anyone has any views on that, or any additions they'd like to add to that.
I mean, we have done a little bit of a review of communication so far, and I think generally the response we're getting from the public in terms of the wide consultation that we're doing is been positive around the messaging so far. Certainly each individual organisation, I know we have had a huge role to play in terms of getting communications out to every household. We've done leaflet drops, you know, we've messaged around the town, we've used our social media. Our social media reach has been phenomenal over this. And I think generally the view is that so far we've managed to get, you know, people have appreciated the fact that sometimes our messaging has even been slightly different to national government's messaging because of the local circumstances of Hartlepool. I think we've reviewed that a little bit as a council, and we've identified some areas, I think, which would be useful to get some of your views on as to how you could help us tackle it. One was how we continue with this population-wide messaging, but also try and link it more and more to messages around how people can protect themselves by living healthier lives, and, you know, try and pick that theme up more. We've also recognised that we need to do more in terms of meeting the diverse needs of our community. There's an issue around digital inclusion, that, you know, we've been able to get messages out fast for those who are media, you know, social media savvy, but obviously we've been reliant on other more traditional vehicles for those who aren't, or who don't have access to it. But there's also been issues around how we meet those in our community who don't have English as a first language. There have been issues obviously flagged by the hearing and visually impaired communities around whether we are, you know, messaging in appropriate media for them. And also, as Craig has said, that's all around the prevention agenda and the good messaging and social distancing agenda. But then there's also the agenda of how we would mobilise in the event of an outbreak, or a situation where we might be looking at a local lockdown in a particular community or setting, how we would mobilise resources around that. So we're beginning to see some challenges going forward. And I think what would be really helpful to understand, and I'm also aware that some really great messaging and comms went out throughout the first phase of this response. You know, the voluntary organisations played a great role, and the FT, you know, the Foundation Trust were great in terms of, you know, how their staff collaborated to help get some good messages out as well. So it's how we begin to try and knit that together in a kind of coordinated plan. And understand what some of the issues are. So I think Craig was interested, as are we, in terms of having flagged some of those areas of potential risk, if you like, for us going forward, how we might you know, use the resources of every organisation represented here and beyond to begin to get some messaging out. We've had feedback already from Middleton Grange, who are happy to use some of their empty shops to use the shop windows to get messages out and things like that. So it's beginning to look creatively at how we can do that. So that by way of a bit of an input and summary from me too, but it'd be really helpful to get people's views on this, because I think this is going to be absolutely fundamental to how we manage this kind of very tricky period as we begin to ease lockdown at a time when we know the virus isn't completely under control. Has anybody got any questions or comments or contribution to make, or do I just start picking people off? Brenda. Thanks.
Jill, you actually touched on something that I wanted to say. I don't think it'll be very helpful exactly, but it is something which I feel very strongly about, that I think as a local authority we've done very well throughout this period of time in dealing with our town, rather than going by the guidelines that have been offered nationally. Those are still blurred. And I think that as a town, we have to be very clear, as we have been. This is not a criticism, it's just to say that I think that what you've been doing should continue. The clear messaging, the communication, and yes, there is a challenge as to how that happens. But I have to say that some of the more positive feedback I've had is from the leafleting, where people can actually see in black and white or whatever colour it was, just a brief kind of format of what the communication should be. And I think that's a very good way of communicating. And you know that every household in the town will get that. And I know that can't be done on a regular basis, but I think it can be done as well as everything else that's being done. So I think we should keep on going in the way that we have in order to look after ourselves and our town and the residents of the town.
Thanks, Brenda. Stephen?
Thanks, Jill. I would echo, I think, a lot of what Brenda's just said there. And I think one of the strengths of the communication strategy that we've had so far has been that it has been multifaceted. And I think that we've done a lot on social media. But I think that the newsletters that have been going out have been absolutely vital and have probably got to a lot of people who we wouldn't have reached if we had just been relying on our social media alone. So I think that's still got to be an important strand of what happened going forward. I think one of the things, again, that I feel strongly about is that one thing that I see happening is that existing health inequalities are being widened by coronavirus. And thinking about some of the conditions that people have, such as people living with cancer, I think part of that communication going forward has got to be around the importance of people accessing some of those services and treatment and care around some of those conditions that people are living with. And that's going back again, I think, to the point that Brenda made early about some of the fear that is out there amongst people, particularly people who have been shielding for 4 months now. But I think part of our communication strategy going forward has got to be dealing with some of those health inequalities, how they are being widened, and also the utmost importance of people accessing some of those treatment programs, which are going to be just as threatening to people's lives if they don't access them in the longer term and medium term. So I think there's some real key messages to get out there. And I think the final thing I would say is I think that the voluntary and community sector is going to be absolutely vital in this. And going back to the point that you're making about some of those different communities that we have within the town, people whose first language isn't English, people with sensory impairments. I think it's really important that we are working with some of our third sector organisations who have some really good links and are trusted and have worked closely with those groups in the past, and that they are fully engaged in that communication strategy going forward. So I think it's got to be multifaceted. And I think it's got to be embracing a wide range of sectors, a wide range of organisations. And again, going back, I think, to Craig's point, be very flexible going forward as well.
Thanks, Stephen. Any other contributions? Tim? Yeah.
Yes, thank you. Really, I just want to echo Stephen's comment about health inequalities. In NHS England, we're very aware of the issues of health inequalities, and we know that the COVID situation is making that worse for the reasons Stephen illustrated. There's a digital divide, which services are moving more and more online and video consults, of which the most deprived don't have access to computers and smartphones, which we're aware of. We're also aware of things like, you mentioned cancer there. We've got a particular problem with cancer and access. Addressing those issues, I think one of the big point is we're trying to get the primary care networks in much more to focus regarding access, because we may be able to use some of the initiative in the primary care network to actually pick up those hard to reach, particularly addressing the hard to reach members of our communities. So I just really want to echo and say we're aware of it, and highlighting it will help in any comms strategy. Yep, thank you on that one.
And that's helpful. So picking up the issue of the digital divide and remote access to consults is going to be an area for good collaboration between partners. Yeah, thanks.
Sorry, there was one final point that I wanted to make regarding the voluntary sector, as Stephen mentioned, is absolutely critical. I was dealing with some of the voluntary sector just this week. The voluntary sector across the board have taken a massive hit because all their fundraising activities have been hit very hard. So they're talking about, some of them 80 to 50% loss in their revenue streams. So I think part of that is support your local charities. And that's what I would like to see in the, because they're all about community infrastructure and community networks. Yeah, that's all.
No, absolutely. No, that's helpful. Thanks. Michael, you've got your hand up.
Yeah, thank you. It was just a couple of points, really. I think one of the things we do, if we haven't already, need to do is just join up some of the messaging. I'm just aware that we've got quite a substantial campaign going at the moment around cancer, particularly across all of Tees Valley. And I think if we've got opportunities through leaflet drops or other things like that to actually get some of that messaging into those areas, that would be really helpful. So I think we could contribute to that, and that would be a really good thing to do. I think the other thing was, and I was thinking more about if the plan is actually enacted. I guess there's also some commitment from organisations that are taking, that are members of this particular board. And what I was thinking was, quite often it's about making sure we've got the right partner and the right organisation and the right person fronting some of the messages, and that might be related to what sector it is. So whether it's care homes, whether it's schools, and maybe just that commitment, which I would take as read from partners anyway, to just be part of that messaging and that kind of response to that as well. Hoping that we don't actually need to do that, by the way, but I mean that is just having it in people's heads that might be a possibility.
When it comes to the mobilising around a particular outbreak, actually having people who are prepared to just roll up their sleeves and get involved in fronting meetings or managing messages, that's really helpful. Thanks. And I think there's an important point there. If we're doing a leaflet drop, then actually, if there are other leaflets to insert, then that's a good way of joining the dots simply in the messages. That's really helpful. And and a lot of the messages will not just be around the social distancing and good hygiene, but we're going to have to be really focused on the wider health of the population and the living healthier lives, both physically and also looking at some of the mental well-being and emotional issues. I think that we'll need to be clear about in terms of, are we getting the messages out there in terms of how people can look after their mental health as well as their physical health in these very uncertain and strange times. Yeah, it's a good point. And if agencies have got something off the shelf that you could just insert, then that's a really good way of using the power of one person posting something through a letterbox. Thanks. Because shoe leather is going to be pretty critical in all of this, I think, going forward, as well as the social media. Yeah. Anything else on comms? We've heard from health colleagues. We've heard from obviously some of our councillors, and obviously the voluntary sector has been mentioned a fair bit through this. I think we've got Health Watch here, and we've got Julian from Hartley Power. Is there anything they want to comment? And we've got Peter Graham from the police. Peter, should we take you now? Thanks. And Christopher, yeah.
Thanks, Chair. It's more of an open question from myself for the broader outbreak plan. I've never experienced anything like this in policing before. Yeah. Did we get it right? Was our engagement right? Did we go in at the right level? Because I'd be interested. We do get that second spike. Do we go in at the same level again with the engagement, the education? Because that feedback was really vital for us how we move forward.
Yeah. Has anybody got any comments on that as a question for me? I mean, I think the police did get it right. I mean, there's a really difficult balancing act here around encouraging and enforcing, and also how you manage that within the resources available. So I mean, I think that largely it's been a really complex and difficult area to manage enforcement around, and I think getting that balance right has been important. As you're probably aware, as a council now, we're bringing together a team of community street ambassadors who will be just walking around key geographical areas, tourism hotspots, shopping hotspots, just encouraging people to observe social distancing and good hygiene. And it's much more around support, engagement, communication, dialogue, but then having an escalation system so that if we needed to, if there was a difficult situation brewing, we could bring the police in. So some of it's around how you connect with wider eyes and ears on the ground. And I think we're beginning through our community safety team to work that through. But I don't know if anybody's got any comments on Peter's question in terms of the policing response. Anyone disagree with me? Yeah. Unless Michael's got a point about that one, I'll move to Christopher, because I think Christopher was responding to the question around the voluntary sector. Yeah.
Thanks very much.
It was just very.
Oh right. Sorry.
Sorry, Joe. It was just very quickly in terms of your comments around the police. I would echo those, and I think the LRF itself, which was actually chaired by the Chief Constable, worked really well. So I think from that point of view, we certainly found some benefits of the response from police. Yeah.
Yeah. No, it was good engagement. Yes. Christopher.
Thanks, Jill. Jill, from a voluntary and community sector point of view, I think we believe that the councils did a superb job in how they've responded and the information that they've put out. And I said previously at the Health and Wellbeing Board that we would be happy to complement any work that the council's doing and feed into the voluntary community sector. I was going to ask from a comms point of view, obviously the contracts that the council have for things like, like the adverts on roundabouts, billboards, working with Hartlepool Life and things like that. Are we still going to utilise things like the wraparounds? Because I can disseminate information with all our contacts across the voluntary and community sector, but are we going to have a look at all those contracts that we've already got in place as well as what we've already been doing?
That's a really important point, and I think part of this is how we use every media available as well as the physical environment, and looking at ways in which we get messaging out on roundabouts on barriers, and that we're refreshing those messages. But I think I'll ask Ed Turner to come in a bit on that, because he's been given some thought to how we use our existing channels. Are you there, Ed?
I am, thanks, Chair. So yes, Christopher, we're planning to use roundabouts and banners around the town, and what we will aim to do is complement the messaging that we're putting out in community newsletters, so that people are receiving a newsletter, and at the same time when they're going about their daily business, they hopefully see the same messaging, so that they'll be regularly reviewed. Craig and I caught up with Jill at the back end of last week, and Denise as well, and we are looking at doing much more of the community newsletters. So it's good to hear that Councillor Thomas and Councillor Harrison feel that they've been well received within the community, and I've also been making notes today just around some of the other messaging that we could include within those newsletters regarding health inequalities and VCS work. But yes, Christopher, in short, contracts, I mean, the Life haven't been printing during the crisis, but we're looking to set up a new contract with themselves so that we would use different platforms throughout this.
Chair, can I just come back just with regards to that messaging? Is I don't think we can underestimate the impact that's had on people's mental health as well, and that's a big concern of ours, and it's whether or not those outlets that are, and I know some of them in our area are going to be up and running more effectively for support from next week. And really, if we can, promote that with some of our key messaging out into the communities, because people really do need that help.
Yeah, I think that's an important point. As you know, we're in the process of producing under the Civil Contingency Act, we have a responsibility to produce a recovery plan. And I think the nature of this pandemic is we'll be managing a recovery at the same time as managing a response. But a critical area, I think, is in relation to mental well-being and looking at what we can do to help work with colleagues across the health and social care and voluntary sector to look at how we respond to what will be a huge impact in relation to the mental health of people. Tim?
Yes, thank you. It was just regarding you were saying, Chris, you're rolling out some additional services for mental health, and I'm asking, is that linked in with our primary care community staff for signposting for example, GP services, so they're aware of your initiatives, and so we can direct patients as needed to them? I'm aware that there's increased demand starting on mental health services in general. It dropped significantly at the early part of the crisis, but part of that was, I think, access, because all the access was through primary care and people weren't seeing the GP in the traditional ways, and people were trying to avoid burdening GPs with that low-level mental health problems. But that's now creeping back in, and I just wanted to know how well your services, Chris, are linking in with the primary care community and the local GPs and the CCGs.
From a Health Watch point of view, Tim, it's purely that we assign posting people through. So today in the office, I've been contacting the organisations we've previously worked with, because some of them, from a support and advocacy point of view, haven't been operating. And what I'm finding is the people we signposting to, a lot of them are going to be up and running again from next week, because we haven't been able to do that. So we're just going to include that in our promotional material we put out from next week.
Okay.
And perhaps one of the things we could do with these household leaflets that we're doing is have a particular focus on how people can access health and support services in terms of their wider physical and mental health. And it would be really helpful, I think, to try and to get the messages across around how GP surgeries are going to be operating and that kind of thing going forward. So that might be something that Ed could pick up in discussion with you and Nick, I think, in terms of how we could get some good messaging out there in terms of the primary care network across Hartlepool, particularly in this area. I've got Julian waiting. Yep. Thanks, Julian.
Yeah, thanks very much, Jill. Just a couple of points. Hartley Power is obviously extremely happy to get across any messaging that is agreed through our MailChimp subscribers, which are just shy of 200 now. I know that the council VCS team all did a mapping exercise of community organisations early on, so you're probably aware of that anyway. Just picking up on the point about the primary care networks, we've been working closely with the social prescribing team, with whom we are extremely impressed in terms of their willingness to work creatively in managing some of the issues that they're seeing. And as people are pointing out, anxiety, reluctance to leave the home are something on which they're working and which we're collaborating with them on. In terms of healthier living, I mean, it strikes me that there is no better opportunity than this week to encourage the formation of social cycling groups messaging couldn't be coming from a higher level about the importance of cycling. And with a little bit of effort, I think we could be encouraging people out in groups, family groups, with that little bit of hand-holding initially, perhaps, Marina to Seaton and back, perhaps. So just a thought on that. Digital inclusion. There's a project emerging, a collaborative project, including the council, to look for some funding to really try and tackle this. Hartley Power is now an Ofcom registered broadband provider, and we're looking at a not-for-profit offer to enable people for whom the main market leaders' prices may be out of their reach. So that's something on which we're very happy to collaborate on, participate in. And just finally, in terms of messaging, I think a really simple, strong message would be to change our use of the term social distancing to physical distancing, because we need to be socially connecting and socially close. Now, obviously, that's a challenge for people who are confined to their homes, but that's where the digital inclusion work needs to come in. But I noticed that the likes of Nicola Sturgeon, Dr. Anthony Fauci in the States, World Health Organization officials are now starting to use physical distancing. And I believe there's an opportunity in the town to try and make that shift.
Good point, Julian. I think early doors we were saying stay safe, but stay connected, and I think that's and I think the use of the term physically distancing as opposed to socially distancing is important, unless you're an introvert, of course. That's been some really helpful comments there. Nick, you've got your hand up.
I was just coming back on the stuff Tim was on about with and Chris about using voluntary sector. Certainly, I'm aware of sort of websites such as Happy Cactus and Couth websites, which have been directing sort of like younger kids with mental health problems too, because there hasn't. I know the CCG sort of counselling service really seems to have come down to one guy working over in Middlesbrough who I've been referring everybody to on a phone call. I can't remember, it was Teesside something or other. I can't remember. I'll look it up and then sort of give the more out. But the feedback from the patients is that he's very good and helpful, this guy. And certainly, you're right, there isn't half as many people ringing up with sort of those sort of problems, although it's starting to increase again. So we have like social prescribers, and I know they're aware of these sort of things, and often will sort of like get advice from themselves, and they're a sort of good link for the voluntary sector to sort of like, tell the GPs, look, if you get somebody in, do this. I inform the local GPs that I see, but we don't always talk about websites like Happy Cactus and things like that. So.
Yeah, no, that's helpful, and I know there's a lot of work going on at the moment with our educational psychology service and our head teachers around the restart of schools and recognising the emotional health and well-being concerns that people have around how schools can be playing a role. So I think there's a really important piece of work to do. I think somebody said joining the dots, but we need to make the whole greater than the sum of the parts in this, in terms of the level of demand there could well be. So that's some helpful pointers there. Stephen, you've got your hand up.
Thanks, Jill. I think on the issue of mental health, I think it's one of the important early messages that we need to be getting out in the communication strategy. I think both through the council, but also through the community and voluntary sector as well. And I think so far what we've seen really is just the tip of a very big iceberg around the impact that COVID's had on mental health within our communities. And I think that what we probably have is a lot of people out there who have never accessed mental health services before. And I think there's a real need to get out the importance to people. around accessing support at the earliest possible opportunity. Because I think, like with a lot of other conditions, if people don't access that support early, very often what you have is an escalating condition, escalating situation around their mental health and well-being, and the impact that that has on them as an individual, but also to their wider family network. So I think there's a real need to include a strategy around getting some of those key messages out, getting that some of that information that Christopher was talking about, some of the services that are coming back on stream, and really encouraging people who are struggling to access that support at the earliest possible opportunity. And as I said, if that doesn't happen, very often the condition just worsens.
That's a really helpful point. Thanks, Stephen. Anybody got any questions on any further comments on this before I bring it to a bit of a close? I mean, what I'm kind of feeling is there's some really important messages to get out, which is around the wider health and well-being messages that we need to start disseminating, particularly linked to the impact of COVID and how people can protect themselves both physically and mentally and emotionally in the next stage of this pandemic. And I know Ed's busy working on a leaflet at the moment linked to physical distancing, I'll start saying, and some of the other key messages around changes to services and things like that. But I'm wondering if, by way of a test of partnership, if there was some people who would be willing to collaborate with Ed over the next few weeks in the design of another leaflet where we could be getting out some of the key messages we think it's important for people in terms of how to access health services going forward, what's available, what we think are the key messages for people, so that we could the next household drop when we're looking to try and do these as frequently as we possibly can. I think that the view is we'll abandon Heartbeat for now and use the resources available for that to get out this public information messaging. But it would be helpful for colleagues across the health, the council and the voluntary and community sectors to collaborate a bit on how we would shape that next leaflet, which would get some important messages out for people about how they can protect themselves by living healthier lives, both physically and mentally. Yeah. Can I ask for some volunteers before I start requisitioning support?
Yeah, happy to do that, Jill.
Thanks, Michael.
Yeah, I think the clue is in your point about health.
Yeah.
So
yeah.
happy to get some engagement into that. Yeah.
Yeah. Nick, could we call upon your support from a GP perspective? Would that be useful? Even if it was just a conversation like this, I think it would be a good steer for Ed. Yeah. You're on mute, Nick. I'm going to write a poem one day saying you're on mute. You've been muted.
Yeah. I'm happy to get involved with anything you want.
Excellent, great. Julian and Christopher.
Yeah, no problem at all.
Yeah.
Yeah, happy to do that, Jill.
Yeah. I wondered if Stephen on the
yeah, I'm happy on the mental
health
side,
and perhaps Brenda on the vulnerable children's perspective as well. That might, and I think it would be helpful to get a counsellor perspective in as well in terms of, that kind of thing. I think it'd just be helpful for Ed to have a reference group almost to make sure that he's covering not just what the council's doing, but what's available more widely, and also for people to kind of give a view of what we think the community's thinking. Julian, I can see you've got your hand up, and Leslie, I think it would be great to get the trust involved as well, and then we'll come back to Ed, who's also got his hand up. So Julian, then Leslie.
Yeah, more than happy to contribute to the. I wasn't aware I'd raised my hand. There's something wrong with my Teams if it is, but
okay,
yeah.
Right, okay, that's great, that's good. Leslie.
Yeah, it was just to say, obviously we'll support however we can. You may already have some links in with our comms team, but we've been doing quite a lot of work around trying to assure people in the public that our hospitals are a safe place to come and not to avoid coming for appointments. So I think that would probably fit in quite nicely.
Yeah. I think that's a really important message to start getting out, isn't it? And given that prevention is better than cure, as much as we can get out in terms of population health and also the work we need to do together to keep the virus under control at a population-wide level in terms of the prevention agenda is going to be important. I think there's been some useful pointers made as well. Craig, I hope you agree in terms of how we mobilise resources in the event of an outbreak, and I think partners stand ready to get involved in that. So we'll need to think about that as part of the next review of the outbreak control plan, which I know you're going to be working on.
Yeah, the mobilisation I think will be key. So I think that will be really helpful.
Yep. Tim, I've got your hand up, and then I'll take Ed. Yep.
Yeah, just very briefly, just to echo that, really important to get people to attend their hospital appointments because, and we know, and I know that from working with the Cancer Alliances, that people who have been referred for further investigation are then afraid to come out during, and they're missing their hospital follow-up. And I think that's really important, and that's going to be a knock-on effect we are going to see from COVID that we're very concerned about. So it's just another message to add to that community comms.
That 4 sides of A4. No, that's great.
Yeah.
So over to you, Ed, in terms of this task that's just been thrown in your direction.
Yeah, you actually sort of made the point for me a little earlier, Jill, but what I'm wondering is whether we could use an edition of the newsletter almost as a catalogue signposting to lots of these great services that are around, but then whether we use subsequent editions to spotlight on in more detail on some of the services that we're talking about, because obviously I guess what we do want to try and do is keep the newsletters fairly short and concise and readable. But very much welcome the idea of working with partners on this group around creating a bit of a comms plan so that we can get those messages out to residents.
Excellent, that's great. And obviously Craig can get involved in that from a public health perspective. Excellent. I might need to remember we've got an agenda. Are there any other is there any other business that people want to raise? Okay, thank you. No, good. Right, it's just to say that the next meeting of this group is the 11th of September 2020 at 3 o'clock. I will then be in retirement. So I'd just like to wish you all the very best in terms of the continuing great collaboration that's going on across Hartlepool in responding to this virus. Nobody would choose to spend the last few months of their career having to help lead an emergency response to a pandemic. It's certainly been very hard, but I wouldn't like to say I wouldn't have missed it for the world, but certainly I would like to say I've never been prouder than to be part of the public sector during these times. And you've been quite remarkable in the way that you've worked together. So thank you all for that. And I do wish you well going forward with this outbreak control arrangement into the future. Thank you. Stay well and enjoy your meeting on the 11th of September, and hopefully the work on the comms plan can happen before then. Thank you very much. Thank you all.
Thank you.
Bye.
Bye. Bye. Jill. Thank you.
Cheers.